All right. Hi, my name is student clinician Dan Mathis. What's your name?
Jeremy. Mathis,
Jeremy, nice to meet you.
Likewise.
Today I'll be performing an orthopedic examination. Anything I say, or not anything I say, will not. That doesn't matter. If anything I do hurts you, please let me know. If you have any questions anytime, please don't hesitate to ask.
Okay.
And if anything you tell me will be held in strict confidence. May I begin?
Yes.
Awesome. So I'll be starting with tests to demonstrate the spinal cord and meninges. So the first will be Le Hermite sign. So I'm going to take your head, and you might have to actually lay back a little bit. There you go, lay down flat. There we go. Perfect. I'm going to take your head, put it pass over your chest. Any pain with that?
Nope.
Awesome. Positive would be electric shock-like sensations down the spine and through the extremities. That would indicate dural irritation or spinal cord injury. Spinal cord inflammation, possibly multiple sclerosis, or compression myelopathy due to degeneration and canal stenosis. Next would be kerning sign. So I will take your hip, bring it up to 90 degrees, your knee up to 90 degrees, extend your leg fully, and bring it back down. Any pain with that?
No.
Awesome. Positive is inability to fully extend the leg or pain in the neck region indicating meningeal irritation, possibly meningitis. Next, I will demonstrate tests of the structure of the cervical spine. So for Soto Hall, I will place my hand on your chest, bring your head up. Somebody pain with that?
No.
Awesome. Positive for Soto Hall is generalized pain in the cervical region, which may extend down to the level of T2. And this indicates a non-specific test for the structural integrity of the cervical region. Next is Valsalva test. So if you could sit up for me, swing your legs onto the floor. Now I'd like you to take a deep breath and hold it and then bear down as if you're having a difficult bowel movement. All right, relax. Any pain with that?
No.
Positive is radiating pain from the site of a lesion, usually recreating the complaint in cervical, thoracic, or lumbar area of the spine, which would indicate nerve root entrapment by a disc lesion, possibly a space-occupying lesion. Next, I will demonstrate a test for foraminal encroachment. So, I will first do, I'm trying to think of the best way to do this. Maybe just stand behind you. So, first would be foraminal compression. So if you can sit up straight for me. There we are. I'm going to press down. Can you turn your head to the right, please? And now to the left. Awesome. Any pain with that?
No.
Positive would be, almost fell. Positive would be exacerbation of localized pain. That's the first one, indicating foraminal encroachment or facet pathology without nerve root compression. The second would be exacerbation of cervical pain with radicular component, which would indicate foraminal encroachment or facet pathology with nerve root compression. Next, I'll be doing a Jackson compression test. So, if you can, we'll do the same thing, stand behind you. Can you bring your right ear to your right shoulder, please? And I will compress. And then your left ear to your left shoulder. Compress. Any pain with that?
No.
All right. Positive with Jackson is exacerbation of localized cervical pain, indicating foraminal encroachment or facet pathology without nerve root compression. Second is exacerbation of cervical pain with radicular component, indicating foraminal encroachment or facet pathology with nerve root compression. Excuse me. So the next one is I'll be testing is maximal cervical compression. So if you can, I'd like you to take your head, turn it over your shoulder to the right, and look as far back over your shoulder as you can. Cool. And then the next side. Awesome. Any pain with that?
No.
So positive with that is pain on the concave side. And that indicates foraminal encroachment with or without nerve root compression based on presence or absence of radicular component. So next we'll be doing cervical distraction. So I'd like to just sit up nice and straight for me, and then I'm going to This one goes here. There, lift up. And can you turn your head to the left? And to the right. Any pain with that? Nope. There are 3 positives with this one. The first is diminished or absence of local cervical pain, indicating foraminal encroachment without nerve root compression. The second is diminished or absence of radiating pain, indicating foraminal encroachment with nerve root compression. And the third is increase of cervical pain, which would indicate muscle strain, ligamentous sprain, myospasm, or facet capsulitis. Next, we'll be doing Bacodi sign. So if you can take, let's say you have a problem on your right side. So can you take your right palm and place it on the top of your head? And then, I guess, that's your affected side, so let's do that. Any pain with that? You can relax. No. So positive would be decrease or absence of radiating pain. This would indicate cervical foraminal encroachment, nerve root entrapment, usually of the C5, C6 level, because this motion elevates the subscapular nerve and relieves traction on the upper brachial plexus. I will now demonstrate tests of thoracic outlet syndrome. So first I'll be doing is absen. So if you will extend, let's take your left arm, extend it fully out to your side. So I will lift your arm up, and I'll find the radial pulse. And I'll slightly abduct it. Now, can you take a deep breath and hold it, please? And if you can slowly turn your chin up and toward me. Look at me. Yeah. All right, no, I don't know any positive findings. If it's negative, then you can rotate to the other side. So rotate to the other side and do the same thing. Up and there you go. Cool. Can you relax? Anything with that? No. So positive would be pain or paresthesia, decreased or absent pulse or pulse amplitude or pallor. This would indicate compression of the neurovascular bundle of the scalenus anticus or the cervical rib. Second is Eden. So you'll just seated and I'll take your arm, find your radial pulse. Awesome, nice radial pulse. And then, can you sit up nice and straight for me? Put your shoulders back and stick out your chest for me. Cool, okay. You can relax. And any pain with that or anything? Okay, nope. Positive would be pain or paresthesia, decreased absent pulse, amplitude, or pallor. This would indicate compression of the neurovascular bundle between the clavicle and the first rib. So the next one will be the right test. So again, I'm going to find your radial pulse. Straighten your arm for me, find the radial pulse. Bring it up slowly and fully abduct while monitoring your pulse. Cool, no pain with that. Right? Nope. Awesome. So positive pain or paresthesia, decrease or absent pulse amplitude or pallor, indicating compression of the axillary artery by pectoralis minor or coracoid process. Thoracic outlet syndrome would be the indication there. Now I'll demonstrate tests of the ulnar nerve. So I'll be doing elbow test. This is my Taylor reflex hammer. It is used to test sensation. I'm going to tap you like this. Boom. Is it okay? Yep. Awesome. So I'll take your arm, flip it over, right here. Anything with that? Nope. Positive would be reproduction of pain at the site being tapped or tendinous being tapped, or paresthesia in the ulnar nerve root distribution area, which are fingers 4 and 5. And that would indicate neuroma of the ulnar nerve. Second would be the Froment paper sign. I think this paper towel should hopefully serve as a good testing material. Can you grab hold of that for me between your thumb and your index finger, like so? And then I'm going to pull this from you and try to resist me. Well, try to resist. Cool. Awesome. You can let go. Perfect. Positive, the patient is seen to flex the thumb, thereby recruiting the median nerve to compensate for apparent weakness. This would indicate ulnar paralysis due to weakness of the ulnar nerve. Innervated muscle would be the adductor pollicis. adductor. Now I'll demonstrate tests for the median nerve, so a Phelan test. So if you can take your hands for me, place them backs to backs and press together like this. Elbows, you'll try to keep it level with your wrists and press together. I would do that till reproduction of pain or for 60 seconds. So 58, 59, 60, you can relax. Any pain with that? No. So positive will be reproduction of pain and or paresthesia in the median nerve root distribution, which is thumb, first, second, and lateral half of third digit. Or sorry, first, second, third, and lateral half of the fourth digit. And that would indicate median neuritis, possibly carpal tunnel syndrome. Now I'll do prayer signs. So again, you're going to take it, but this time you're going to do the prayer. Hands pressed together against each other. I would do that till reproduction of pain or for 60 seconds. So 58, 59, 60. And any pain with that? No. Awesome. Positive would be reproduction of pain or paresthesia and the median nerve root distribution area, which is first, second, third, and lateral half of fourth digits, indicating median neuritis, possibly carpal tunnel syndrome. Next, I'll be doing a Tunnel wrist sign. So again, my talar reflex hammer. If you can place your left hand, put your thumb and your pinky together and place it down on your leg. Tap it right there. Any pain with that? No. Awesome. Positive would be reproduction of pain or tenderness and or paresthesia in the median nerve root distribution area, which is digits first, second, third, and lateral half of 4, indicating medial neuritis, possibly carpal tunnel syndrome. I will now demonstrate tests for the thoracic spine. First will be Adam's sign. So, I will have to stand behind you on this one. So, let's see. Yeah, yeah, that's fine. That works. Can you bend forward at the waist for me? Awesome. And back up. Cool. So, I would be looking for evidence of a change in scoliosis. There are 2 positives. The first one being a scoliosis observed to straighten. This would indicate negative evidence of functional scoliosis, trauma, or subluxation. The second one would be a scoliosis does not straighten, and I look for rib humping or muscular imbalance. That positive being evidence of a structural scoliosis. The next test is Beaver sign. So if you can cross your arm, or actually you have to lay down for this one, so if you can lay back flat on your back. Now I'd like you to cross your arms for me, across your chest, and I'd like you to do a partial sit-up for me. And actually, before you do that, I'm going to look at your... Now lift this up, is that okay? Awesome. Alright, so do the partial sit-up for me. Awesome. Okay, back down. Perfect. What I'd be looking for, the positive is superior or inferior movement of the umbilicus, and that would indicate superior movement of the umbilicus being a spinal cord lesion at the level of T11 to T12, or lower abdominal weakness. Now, inferior movement would be indicative of nerve root involvement from T7 to T10. And the next and last test will be Sheppelman sign. So if you can sit up for me and swing your legs out to the side. Now, can you take your arms outward and above your head for me? And then I'd like you to bend to the side, left side, and then back to the right side for me.
Well, I think I did that reverse.
Oh, sorry, yeah. Yeah, there you go. All right, awesome. Perfect. Now, any pain with either one of those movements?
No.
Cool, so positively pain on the convex or the concave side, indicating if the pain is on the concave side, would be intercostal neuritis. You can use thoracic dermatomes to evaluate the corresponding intercostal spaces. Now, pain on the convex side is indicative of fibrous inflammation of the pleura, or possible intercostal myofasciitis. So this concludes week 7's lab test. Thank you very much.